This is the supervised toothbrushing training for special schools. The information in this training has been sourced from the 2016 Public Health England guidance document, Improving Oral Health, Supervised Toothbrushing Programme Toolkit. It is requested that schools run the scheme as detailed in this programme and in line with evidence-based Public Health England guidance, rather than implementing their own systems. The aim is to deliver an effective supervised toothbrushing scheme in schools. Toothbrushing Programme is a nationally recognised, evidence-based oral health initiative for children, designed to improve children's oral health, increase exposure to fluoride, promote behavioural and self-care skills. The objectives are to provide supervision and ongoing support with staff training, cross-infection control, consent for participation. Implementing the programme. It is a requirement of the programme to assign a designated lead person who will be responsible for ensuring staff training is completed and monitored, gaining and storing records of consent, ensuring cross-infection procedures are followed, maintaining contact with your named dental professional. Your dental professional will provide training and support in providing the programme, toothbrushes, toothpaste and storage racks, assistance implementing the toothbrushing initially in the classroom, annual face-to-face visit and oral health talk to children and parents. Consent. Consent letters will be provided for the school to send out. Forms should be sent again for any non-responders. Only children with consent can participate in the programme. Toothbrushing. This should be organised in a safe and effective way which is integrated with school and home routines. It is important that children are encouraged to also brush their teeth twice a day at home. Toothbrushing can be carried out in groups or individually, and children should be seated. It should be carried out at an appropriate time for your class, and children should be encouraged to brush their own teeth. Supervisors can assist with any children who require additional support, but must ensure it is safe to do so. Toothbrushes are appropriate to age and ability, individually identifiable for each child, and replaced each term. For older children, adult brushes may be used, but these must be stored in ventilated containers. Toothpaste. Regular daily toothbrushing with an appropriate fluoride toothpaste is effective in preventing dental decay. Toothpaste must contain at least 1,350 parts per million fluoride. A smear of toothpaste is used for children under 3 and a pea-sized amount for children aged 3 and over. For any children with sensory issues, non-foaming and flavourless toothpastes may be used. Children should avoid swallowing the toothpaste during and after brushing. Once brushing is complete, children should not rinse, and any excess toothpaste can be wiped away. Cross-infection. Supervisors should wash their hands before and after the session and cover any cuts or abrasions with a waterproof dressing. Toothpaste must not be applied directly to each child's toothbrush. Pea-sized amounts of toothpaste need to be placed on either a paper towel or plastic plate, then transferred onto the toothbrush. Toothbrushes must not be soaked in bleach, cleaner, or disinfectant. After toothbrushing, the brushes are to be rinsed thoroughly and individually under cold running water and placed in the storage system to allow them to air dry. Toothbrushes should not be washed together in the sink and should not touch the taps or sink when being rinsed. Toothbrushes must not be soaked in bleach, cleaner, or disinfectant. The toothbrush racks comply with best practice in the prevention of cross-contamination. Toothbrushes are kept upright, allowing enough distance between toothbrushes to avoid cross-infection. Brushes and racks have corresponding symbols and space for names, allowing for individual identification. Storage systems must not be kept in toilet areas and must be kept out of reach of children. Storage systems will be supplied with covers, which must be used at all times. Storage systems should be wiped daily to remove any drips. The storage systems should be wiped weekly with household detergent and warm water. Storage systems, trolleys, and storage areas are to be cleaned, rinsed, and dried at least once a week. Dedicated household gloves should be worn and all cuts and abrasions covered with a waterproof dressing. Storage systems are to be replaced if they become cracked, scratched, or rough. Although it is not recommended to brush straight after food or drink, it is acceptable for schools to fit in toothbrushing around routines and implement at a suitable time. Monitoring of the toothbrushing programme will include observation of the toothbrushing session, discussion of the standards with the school oral health lead, feedback and follow-up. Schools will be provided with a copy of the standards and guidelines. Supervised toothbrushing supplies and resources can be found at a number of retailers, including the Toothbrush Rack Company and the Oral Health Foundation's Health Education Shop. Toothbrushing procedure. Supervisor washes his hands before and after toothbrushing. Under supervision, child collects toothbrush from the rack or supervisor hands brush to each individual child. Children are seated to brush their teeth. Toothpaste is dispensed onto paper towel or a clean plastic plate and applied to the toothbrush. Children brush for 2 minutes. After brushing, any excess paste is wiped on paper towel. Paper towel is to be placed in the bin. Brushes are placed in the rack to be rinsed by a member of staff. Children should not touch each other's brush. Brushes are left in the rack to air dry for 1 hour, then the lid is placed back on the rack. Paper towel is used to wipe away any visible drips on the storage system. After toothbrushing is complete, children and supervisor wash hands. Thank you for listening. We hope you found this training useful.